Hello and welcome to the SHSMD webinar, How to Measure and Improve Your Patient Attraction and Retention Growth Strategies, Part 1, Best Practices for Data Utilization and Measurement. SHSMD would like to extend a sincere thank you to HSSG and Huron for sponsoring today's webinar. Before we begin, I'd like to cover a few housekeeping items. First off, this webinar is now being recorded and is in broadcast in listen-only mode. Additionally, we welcome your comments and questions throughout the presentation. Click the chat icon in the lower right-hand side of your screen to enter your question or comment, as we have allotted time at the end for Q&A. You can select all panelists to direct your questions to the speakers. Now it is my pleasure to introduce today's presenters. DJ Sullivan is a director for HSG Advisors, a national healthcare consultancy that takes a comprehensive, data-driven approach to working with hospitals and health systems to build differentiated strategies that are customized to their market needs. Matt Welsh is the Director of Customer and Partner Success for Huron, a global consultancy that collaborates with clients to drive strategic growth, ignite innovation, and navigate constant change. DJ and Matt, the floor is now yours.
Thanks for the introduction, Tom, and thank you everyone for joining us today. As Tom alluded to, there is as I know people are going to probably be filtering in over the next minute or two, there is a poll going live that if you'll have the ability to respond to that, we'll get to the details and probably review the results in a minute and then also talk through why that question may be a tad bit of a trick question as we get into it a little bit further. But so once again, thank you to the American Hospital Association and SHSMD specifically for allowing us to be a part of this presentation in this webinar series today. Myself, DJ Sullivan, director with HSG, as Tom alluded to, and then I'll let Matt introduce himself briefly as well.
Yeah, good afternoon, everyone. Matt Welsh, Director of Customer and Partner Success at Huron. Happy to be joining you guys and looking forward to our conversation here today.
The next piece, I'll give a 2-second overview of HSG. So as alluded to, we have kind of already, we're a healthcare consultancy that works with health systems predominantly across the country around 5 key service areas. Today, the focus is going to be on physician strategy and network integrity and how those 2 service offerings kind of combine together to make sure that organizations feel like, 1, they have the data they need, and then 2, how can they utilize that data in a meaningful way to drive their growth strategies as an organization.
Yeah, thanks, DJ. So as I mentioned, I'm with Huron, global consultancy. A significant portion of our business is within the healthcare industry. Huron actually acquired Perception Health, you see in that bullet point, at the end of 2021. We had been working with Huron. I was part of that Perception Health team. We've been working with Huron over the last 4 years, but it really ramped up over 2021. Projects we were working on to ultimately drive clinical transformation, digital transformation for their healthcare customers. They saw a lot of value in where we can go together. So the acquisition happened. So excited to be part of the firm and seeing what we can do to improve the healthcare space nationwide.
Thanks, Matt. And the one other piece I'll touch on before we have Tom close this poll up is around, as we've alluded to already, with this being part 1 today, we do have part 2 in 2 weeks, which will include myself, but then also from Baptist Health Jacksonville, 5-hospital system in Jacksonville, Florida. We want to really take a lot of the processes we're talking through today and see how they're applied to a health system, both from a best practices learning standpoint, what are barriers that need to be overcome to have some of these insights and approaches be successful. So we have 2 director level individuals from Baptist Health that'll be joining as part of that presentation. So if you haven't been a part of that, that's actually probably where a lot of the rubber meets the road of what we're going to talk through today. So probably a valuable thing to think through. We have a couple of links here, but then also is a follow-up for those that have attended and or registered. You have the ability to be a part of that session in 2 weeks if you'd like to be as well. So getting into the nuts and bolts of today, and Tom, maybe let's close up that first poll and kind of see if there's a way to kind of see where those initial results kind of came back from and what that looked like. And because there's a few things that I think are important from an organizational standpoint as we've kind of talked through this and think about what are key performance indicators that health systems need to be able to be successful and achieve their growth strategies. So we actually break that down into, there's probably, to my statement earlier, if that's a bit of a trick question, there's probably shouldn't be one individual key performance indicator that's driving all of your growth initiatives. So as we'll talk through that, we'll focus on what we define as patient attraction versus patient retention, and how both those strategies differ and how they should impact your organization's growth, as we kind of have the results pulled up here, where, you know, about 1/3 of the respondents focused on inpatient market share, about 1 in 5 saying there's no standard metric, then others kind of having, you know, a plethora of whether it be outpatient market share, retention, patient referral, patient leakage metrics, kind of being what's driving your organization now. So you kind of see some significant variance kind of across the board, even within this group of respondents that's on the webinar today, which is what we see very consistently in our engagements kind of around the country. So first, we'll talk through those two strategies, get into how we can go through the ability to define KPIs that are impactful and right for your organization. How do you have the ability to measure and manage those in a meaningful way? And then how does that lead to leveraging incremental data and utilization of incremental data once you understand what those key performance indicators are for your organization? Then our goal is to leave about 10 to 15 minutes at the end for some Q&A based on availability and what questions may feed through. So feeding into that, the place we'll go first is really, why is this an important thing to focus on? And from our perspective, HSG, we did a survey in late 2021 where we wanted to more or less ask our health system clients, what percentage of them feel like they have the right data at their fingertips to make strategic growth decisions. As you can see, about 1 in 3, 37% of our respondents from that survey told us they did not feel they had the appropriate level of detail and data at their fingertips to drive their growth strategies in an organization. You layer the inability or the lack of availability of the appropriate data with trying to balance the current healthcare environment of the fee for volume versus fee for value balancing act that everyone's well aware of, where we need to think about how are we getting more patients in the system while simultaneously saying, how can we manage the care of those patients in a more meaningful way and get them to the appropriate sites of care based on their specific needs. So there's definitely a balancing act that kind of creates this conundrum of how do we take data we have that's available, make it meaningful, and then apply it to our specific situation. Anything to add to that, Matt?
Yeah, absolutely. So obviously fee for value, fee for service is not going away, and we work with our customers every day to help them drive those volumes up. But as we work with more pop health and value-based care folks within the healthcare organization, the fee for value, value-based care is seen as a big driver of future growth, more from an EBITDA bottom line perspective than the top line that the fee for value is certainly going to go drive. So having a right balance of these two in place as this transition, which seems to have been going on for a long time, is happening, is really important.
Yeah, for sure. So being able to then understand that we're trying to manage that, as well as another thing we like to focus on, is that there are just so many potential data inputs that can feed your strategy and how you want that strategy to evolve. So we've put a list of 7 to 8 or so that jump out to us that we hear from organizations all the time. How do we utilize predictive analytics? Is that something we should be using? What does general market demographics and or access metrics look like within our organization? How is that impacting our strategy? So there's all these separate data inputs, and then how do you balance those in trying to build a strategic output, whether it be related to service line specific planning, patient brand loyalty, how do we build the comprehensive manpower development plan? All those different outputs that are feeding our strategy have multiple inputs that one may line up identically just one-to-one, but there's most likely going to be multiples of those inputs that are feeding into each of those individual outputs in some form or fashion. Are there other metrics, I guess, Matt, that you guys see frequently?
A couple that on this list that I want to speak to. So leveraging predictive analytics to then drive that patient attraction and retention. Using machine learning, AI, we've built a number of predictive models that can identify patients who are trending towards a diagnosis of various forms of cancer or other chronic conditions like CHF or COPD. If we can help you, the hospital, engage with those patients sooner, where they might not realize that they have something so serious to be concerned about, and can help diagnose sooner or even prevent them from getting that diagnosis, I think you're going a long way towards creating a very loyal, happy, satisfied patient, which certainly is from an attraction standpoint is there, but the retention is just as important. So a couple ways that we're using those capabilities to attract and retain patients for our health systems.
Love that. And being able to then focus in on this a little bit more specifically, where we'll go is then, how does this impact specifically the growth aspect? So really, we're going to hone in on this market growth piece. And we believe that should really break into two separate buckets. So where Matt was already alluding to a little bit is one, patient attraction. So this, from our point of view, is focused on how do we get incremental patients into our system, and is typically very market-based, service line based, geographically based, where we're understanding how do we make sure that more lives are within the access points of our health system, and doing so in a convenient way. So there's a plethora of metrics that we've pulled up here of these are those analytic inputs that may feed into that strategy development, where it can be referral source alignment, what providers are already sharing patients with us. Is that an area to incrementally have more patient access based on those relationships that already exist? Maybe it's a provider needs standpoint, so understanding there's some markets in our geographic area that are underserved for certain specialties and or services. How do we create the access points for those patients in a meaningful way? It can be via telehealth, via increased patient access locations, physician practice locations, whatever may make sense for your organization. But really, the patient attraction piece being very focused on incrementally getting outside of where we are today and aggregating more patients and having availability of service to more patients in our areas and to support our specific service lines. Taking that the opposite and converse way, so now thinking about patient retention strategies. So from our point of view, this needs to focus more on how is that patient entering our side of care, and how are they entering those sites of care today? And then being able to differentiate how we treat one patient population versus another, and then how do we maximize our ability to keep those patients within our system based on how they're entering it. We've pulled out three groupings that we see very, very common and hear very common from organizations. On one, their primary care patients, want to understand specifically how loyal is that patient population base to our system. If a patient's coming in to our primary care practices, what's our ability to keep that patient within our system? Typically going to be your highest loyalty patients most frequently. Secondarily, another grouping being those ED patients. So the ones that we hear about so specifically, of being able to say they're coming in, there might be very emergent services that they're trying to receive, or maybe they don't understand the appropriate sites of care. So how do we focus on the educational components to maximize retention of those patients? And then thirdly, the grouping that we like to call out a little bit more specifically sometimes based on the markets that we're working in, being able to have it be whether the urgent immediate care patients, which are typically the patients that are most well educated, understand appropriate sites of care for the most part, understand the ability of each organization to provide specific services, and probably doing a lot more shopping around of what's the appropriate site of care which they need to enter a health system. So that each of these groupings, as you think about those patient panels, one, how they differ, and two, then our strategies to retain those patients within our systems also needs to differ. Anything to add to either of those, Matt?
Yeah, one thing, so even related to one of the bullet points on the previous slide, that patient access, how quickly are patients able to go from one of your PCPs to a specialist? How does that compare to other similar specialists in the market, and using data to ultimately measure that for your own providers, the employees, versus your competing providers who are in the market? Patient access and the ability to obviously get into see a specialist quickly leads to higher patient satisfaction, or certainly one component of that, which goes a long way towards that patient retention and loyalty.
Absolutely. So to recap, the difference from our point of view being very focused on patient attraction strategies being very focused on how do we, more focused on markets, geographies, service lines, patient retention strategies, being a lot more focused on those specific patient populations and the entrance points in which they're accessing our system. So I think those are key points to reiterate, is that's going to flow through a lot of where we're going next with potential metrics and how we have the ability to measure and manage those in a reasonable and manageable timeframes. So next we'll have Tom, if you'd be willing to pull up our second poll, which we want to really understand from the audience. Please do make sure that we have the ability to measure your organizational KPIs. How effective do you think they are at measuring your success for growth strategy development? So that'll be up for about a minute as we transition and kind of make sure as we're thinking through what metrics exist and how do we think they're right and optimal for our organizations. So as that flows through, what I'm going to start to talk through is a component that we define as kind of the data, information, knowledge, wisdom pyramid, which I'm hopeful many of you have probably seen, depending on how your organization works and how data flows through your system. But being able to really understand translating individual pieces of information and individual facts, how do we turn that into actionable information that we can use to make strategic decisions around? So in our ability to do that, like I'll use myself as an example, that I might start as an individual data point where I go in to see my PCP and we'll say I'm being tracked through a claims-based system where I'm one individual line of data saying that I went and had an office-based visit with my PCP. We're going to then put some context to that, translate that to information where maybe I'm also receiving sites of care at a health system in my local market. I have some other labs I'm receiving. I'm going for my annual checkup at a little clinic or an immediate care to kind of understand and make sure that I'm getting my, to make sure that my payer is set up and my health is appropriate. So then we have multiple lines of data that all rely to me. So how do we start to aggregate and structure that data in a more meaningful way, which kind of takes that individual data point, translates it into information, and ultimately leading to how do we do that at a meta level. So we're going to do that when we're taking and trying to convert that to knowledge. We're going to say, not just me as DJ, but I'm here in Louisville, Kentucky. Let's understand all 1.5 million people within the greater Louisville market and understand how do all of those patients utilize data and utilize their healthcare system. Are they using it a lot higher percentage of inpatient services when you compare that nationally? Are there certain markets within even the Louisville metro area where there's a lot higher utilization of inpatient versus outpatient services? Is there higher utilization of primary care versus urgent care? And starting to apply some of that data and putting meaning to it that's informational for us as an organization. And then taking all of that and saying, how do we take that information that we've created and that knowledge of understanding how patients flow through the sites of care, and then turning that into actionable information, which is going to take really the insight component of taking people within the market, anecdotal observations of providers, physicians, executive level members, service line leaders. We're going to have to take those data components and apply context and meaning based on everything that we hear and see within our markets to make real strategic decisions off of. So I'll pause for a second, Matt, and let you maybe elaborate.
Yeah, thanks, DJ. So you've summed it up really well, and we've worked great with HSG and DJ and their customers over the years in providing this data that they are ultimately producing these insights. They provide that context and meaning like you see there. Big thing is, and what we're seeing with our customers too, though, is the insights are only as valuable as the action you're going to take from them. And even more specifically, who owns that in your organization? A lot of the organizations don't have that piece of this fully thought out. Who's going to own this process, really driving to the behavior change to seek that ultimately that growth that you're looking for? Having that executive sponsor to ultimately be able to drive this from an organization perspective is key.
Yeah, and Matt, it was interesting looking at the poll results real quick while you were kind of recapping some of that. It looked like for this audience specifically, where almost a traditional bell curve, to be honest, where we had 3% of respondents said they feel their data is very, very effective. About 10% saying not effective at all, and then kind of that big bubble in the middle kind of saying, yeah, we think it's relatively effective, but there's probably opportunity for improvement, being about 40% of respondents. So sometimes it's nice to understand that I guess we see the common issues kind of across the board, and then being able to kind of apply context to that and say, how can that affect this audience specifically is also always helpful.
Yeah, you're not alone.
You are not alone. So where we're going to go from here is maybe walk through some examples that are focused on some of the engagements that we've worked with clients on really their focus around what are some potential key performance indicators they've utilized within their organizations. And so where we'll start is first on this patient attraction piece, which once again, remember, this is going to be focused on markets, geographies. This is how do we make service lines, how do we get more patients within our system and accessing our overall sites of care. So this is a potential dashboard in which an organization we've partnered with is very focused on trying to understand the dynamics between their inpatient, hospital, outpatient department, ASC environment, and then physician office environment. How do their service line offerings differ based on those organizational service lines? So if we walk through, maybe I'll just look at orthopedics, for example, the second line down, where you can see inpatient based, if we're looking at, an entire market, maybe this is 1 or 2 counties that the health system defines as their inpatient service area, is our primary service area, we could say as an example. They're capturing 70% of the inpatient orthopedic volume from that patient population. You translate that to look at then just the hospital outpatient department ASC, view of the world, where that percentage drops by nearly 20% to roughly that, 50-ish% range, 52.4 as things are trended over time. And then ultimately saying, okay, then how does that differ by the physician office component? And what does our percentage capture look like for what's taking place in the physician offices specifically related to orthopedic care, where that's where obviously the biggest variance exists, where this individual client understanding there's almost a 30% variance in their capture of inpatient orthopedic services versus physician office outpatient orthopedic services. So a huge variance that exists, but helps them obviously drive where do they need to begin to, one, dig further, and also understand what's meaningful for them for an organization from a growth strategy development standpoint. And so being able to do this, you can see as you look down, there's roughly 20 or so key service lines that this organization's focused on, some of them only outpatient specific, some of them a combination of inpatient and outpatient. And so trying to understand where some of those largest variance occurs, and then how do we make sure that, one, our executive team has this level of information pushed to them in regular intervals. How do we do the same thing for service line leaders, et cetera, to make sure that they feel they have the right data in front of them at the right times?
Yeah, one thing we've seen, DJ, is the ability to capture more of those lower level visits that occur within the physician offices. In the orthopedic example, if you can capture that, the diagnostic testing, the general consultations, even some of these offices are doing PT right there. As you're able to grow those, the smaller procedures, that leads to the growth in the surgery centers and in the inpatient setting for the knee joint replacements or hips or spine surgery, you name it. The focus on the physician office and growing that has typically led to upstream improvement in those other settings.
And I think, Matt, that's a great thing to reiterate why we believe there needs to be both patient attraction and retention strategies, because this component can be focused on how do we just make sure more patients are getting in. Once we know they're entering our orthopedic practices, how do we have measurements to understand what's our ability to then keep those patients within our systems to, achieve the items that you've said to lead to the inpatient setting, other surgical services, et cetera. So that's one example. Another is going to be, this first metric, backing up quickly, is kind of, procedural volume based, probably more traditional market share figures, which a lot of your organizations have probably seen. But a secondary component is then how does that translate actually from a revenue standpoint for our organization? So being able to take kind of a same comprehensive approach, but understand from a revenue-based understanding, what does that actually mean, our market capture, what does that mean financially to our organization, which we've seen a lot of organizations start to translate market share figures to more revenue-based numbers over the past number of years, where we have the ability to now say, if we rolled all of our service lines together, our primary service area, we'll say as an example, then maybe we're starting on the figure on the far left, 34.6% of all of that volume, inpatient, outpatient, physician office, labs, whatever may be provided, we're capturing 35% of that volume at our owned sites of care. So the dark red portion would be our owned entities. Maybe the pink red portion for this example actually gets into services that maybe are potential joint ventures. So we might have a number of ambulatory surgery centers in our market where we have joint ventures with those physicians on the actual ownership. So it's still revenue to our organization, but we need to understand how it impacts us differently. So being able to do so and understand what that dollar figure looks like. And then ultimately being able to translate, what does that look like over time once again, and then breaking it down to specific payer classes. So what does that look like for commercial versus fee-for-service Medicare, governmental payers? What does the relative volume from a revenue standpoint look like from those separate patient populations? And two, what is our capture? How is it differing for those? Where you can see for moving to the far right, the commercial bucket, for example, we're capturing roughly 40% if you add up the 31 and the 10 in Q1 2021. If you look at governmental and other payers, other governmental payers, we're capturing roughly 55% of that volume. So there's going to be variance even based within the individual payer groupings. And once again, you'll want to have this feed down to service lines, sub-service lines, depending on what your market needs may look like.
Yeah, one thing I'll add to that, DJ, is looking at this and that from a share of care perspective, it even can be taken when you're using a claims data source to get a good understanding of, all right, for all of the patients, let's say in our market who are having a colonoscopy, where are they going within the next 60 to 90 days to ultimately have any surgical procedure if necessary? We worked on an example like this with a customer in a rural market. They found that a large percentage of the patients who are getting the screening done at home were traveling north about an hour and a half to get the surgery done in a larger hospital when their hospital was fully capable of those types of procedures. Identifying those areas for growth and then tracking how is our share of that care of those surgeries specifically growing over time became a big driver of revenue growth for that organization.
Yeah, super helpful. So we're going to pivot slightly to now focus back to those patient retention pieces. So this is going to be more focused on how are patients entering our system and what's our ability to then keep those patients within our system. So some of the metrics that we've, at least some of the samples that we pulled together, this being an example from a client where they were focused on patients that come into their primary care practices. What percentage of the time are those patients then going to some of their specialists within a determined time frame? So this actually represents a 90-day time frame where me, DJ, I go see my primary care provider. If within 90 days I also go and see a general surgeon for some service, what percentage of the time is that surgeon affiliated and associated with the health system, or is it outside the health system? So using the example maybe on the far left, where you could say, I go in, see my PCP within the Q1 time frame, 46% of the time, those primary care patients are going to an employed general surgeon. 48% of the time, they're going to an other active medical staff general surgeon, but not necessarily one we employ, with some minor leakage of the gray portion of the bar, less than 10% going outside the system entirely. So you can then obviously understand what does that look like across the board for key service offerings that we have, key specialties, as well as then being able to track what's our progress and our ability to improve retention for each of those service offerings over time, which is really the root of where we're trying to get. How do we make sure that, one, the data is simplified in a way that's meaningful to us, while two, being able to have it track and measure progress on regular intervals for our organization. The next piece I'll hop into is then the ability to potentially do that at an individual provider level. So if we took all of that data we were just looking at, let's pinpoint into a specific primary care practice. This happens to be an 11 primary care provider practice where you have the same ability to want to understand. Some organizations utilize their internal EMR, which we'll talk through some of the data components around the ability to do that most effectively from a measurement standpoint, but being able to really look at what does that opportunity look like. If we take orthopedics as an example, the third column in, if you look down that column, you can quickly identify that PCP4, PCP5, and PCP10 are potential opportunities for incremental orthopedic keepage within our system specifically, and what does that look like as we continue to track and measure that over time. The last piece I'll focus on is going to be, once again, a revenue-based understanding, but now getting focused on a patient population specifically. So this is taking, instead of being market-based on attracting new patients, now focused on our ability to retain those patients. So this focused around maybe that employed primary care and urgent care grouping that we discussed 10 or so slides ago. Maybe let's lump those two together and understand what is our keepage for the overall spend for those patients, getting back to a revenue-based figure. How is that trending over time? So if we took just the top line there, if we looked at our entire employed primary care group, along with all of our urgent care practices, a patient goes into any one of those sites of care, what's our ability to keep all of the incremental service volume that's coming from those patients, where you can interpret that as this Q4 2021 timeframe, where roughly 67 cents of every dollar those patients are spending on their healthcare services, inpatient, outpatient, physician office, lab, home health, whatever it may be, that we're capturing 67 cents of all of those dollars being spent. And then what does that mean from an overall patient volume and expected reimbursement value to the organization? Then being able to differentiate by, maybe we look at our organization from region specific, where you can see that in employed group region A is capturing about 63 cents of every dollar in that Q4 21 timeframe, while employed group B is actually capturing 72 cents of every dollar. So how do we start to understand even differences within our own organization from one market to the other based on how those patients are entering the system specifically?
Yeah, one comment to add there, DJ. We've used orthopedics as an example throughout the webinar here today. One of those is, say, all of the orthopedic surgeries that happen in patients, and then where do they go for, say, PT afterwards. A lot of it is being more prescriptive about making sure they know that you have PT options available in a location that's convenient to the patient. Yep. You'll see, though, within a claims data set, patients who flow to competing PT or competing home health services. You can illuminate some opportunities for growth by, hey, maybe we don't have a physical therapist office in the location that a lot of our patients are coming from, near where their home is, so that it's convenient for them. You're going to uncover these types of patterns as well when you're using these claims data sources.
Yep. Yeah, thanks, Matt. So the piece we'll flow to next is really the measurement and management of those potential key performance indicators that may make sense for your organization, where we're focused first on the main thing that we want to drive home is that there's no real silver bullets to any of this. We need to, one, make sure that we have the ability to measure what it is we're trying to achieve. So that's creating benchmarks, trending over time, identifying next level detail that we need to get to, trying to understand those measurement capabilities, and ideally using standardized sources to do all of that. So being able to, what we see a lot from many organizations is trying to pull separate sets of data insights from a lot of different places that don't necessarily jive with each other, just based on how the information is being pulled and the actual source of the information. So that's one thing we see very, very frequently from the measurement side. As it gets to the management side, it really gets down to making sure that, one, we feel like the right people have the right information on consistent basis, that they have, we find that engaging providers in discussions around why patients may be leaving the system, what are potential strategies, we think is a critical step that we'll even elaborate on a little bit further. And then the last piece is really making sure that we dig into specific areas where we think there's kind of a next level understanding of, like the example we gave earlier, that inpatient orthopedics is probably not something we need to spend a lot of time on our ability to attract more patients to. Physician office outpatient orthopedics, we need to better understand why are those percentages so different and how do we dig further into that, with obviously the ultimate goal being creating a repeatable system that can really keep us focused on incremental improvement, not just getting to the end point immediately, but how do we make sure that there's steps along the way and ensure that we're making progress in the right direction. Anything to add to that, Matt?
I think the ability to measure and trend over time for sure, and from a common data set to understand how patients flow through the market, again, very important from a management and measuring from a KPI perspective.
Yep. Is there anything, as we talk about, I guess, common gaps that we see, are there any of these that jump out to you a little bit more than others?
So for us and for customers we've worked with, especially as you start to deal with larger systems, most have already had access to state level inpatient data. They know that inpatient space really well. They of course know what's happening inside their system better than anybody ever will through what they are getting from their EMR. The anecdotal feedback that's collected by physicians directly or business development, physician liaison type folks, all very important. But when it comes to understanding what's all happening around us, having one common data set to do this is extremely important. We've worked with a number of customers, again, especially the larger ones that are using multiple external data sources to, one, set goals, identify strategic areas for improvement, then a separate system potentially to even measure them. Strategic planning might be using one system. Physician relations is using another. Marketing's even using a third. If we can consolidate all of this into one external source of truth by which we're setting strategy and then measuring the growth and the results of our efforts, that is as important as anything, I think, when we're talking about that external data source.
Yeah, love that. And that's the thing for sure when we hear a lot of the times we engage with organizations on focusing almost too much on the anecdotal observations is one thing we hear as kind of that initial measurement, when really, as we think about back to the pyramid we talked about, the anecdotal piece should almost be that last aspect that we're adding after we've aggregated data, made sure that it's turned into information and knowledge. Turning it into wisdom is where the anecdotal piece really fits in most specifically to make sure that how are we taking all of these data sets and applying them to our market and our use case most specifically. And so it's sometimes important to make sure we, while we're using all these sources, we're almost using them in the appropriate manner and their place within the process.
Yep.
As we talk about then the ability to manage some of the KPIs, so we pulled out 3 groups that we have found most specifically where organizations are always focused on. One, having, to where Matt alluded, consistent data feeds on really understanding and measuring those KPIs that we've developed. So obviously executive leadership, they're going to have some way to understand both our attraction and retention strategies and what are those key performance indicators and how are we tracking those over time. But then you get into the marketing and strategic planning efforts who are going to help drive a lot of the improvements around our ability to increase those strategies and move them in the right direction, where they're going to need different levels of information, but ideally everything they're doing is going to feed back to that executive level piece. We're going to have incremental service line breakdowns, geographic breakdowns, provider specialty breakdowns, et cetera, but those need to probably live at a different level. And how do we make sure, one, that those, as Matt said, keep those data systems consistent while ultimately driving and making sure that our key performance indicators we've selected are continuing to drive us in the right direction. So the last piece I'll touch on is really that one that I talked about where engaging providers in the root cause discussions. This is one thing that we as HSG kind of really focus the most on once we have the KPIs developed, once we feel like we have the measurement and management tools relatively in place, when we're turning that information into knowledge of how it's going to apply to our strategic initiatives, there's key patient and provider factors which always come up very consistently, but engaging the providers in that discussion we think is so critically important, because it's often not Dr. X, your patient is coming to your practice and leaving, but do you know that 30% of the patients that are coming into your practice are actually going outside for general surgery services may be one way to articulate that, patient retention metric at kind of the organizational provider engagement level, and having them kind of talk through. This is a list of some common root cause things that we find organizations bringing up, whether it be patient factors that are just timeliness of getting patients in to see certain specialties, insurance issues, just provider reputation in the market, a lot of those things, as well as then the provider factors of really focused around what do those existing relationships look like with other providers they may already know. What's the health system relationship? And sometimes if you don't have the data at your fingertips to drive the discussion, you'll never understand some of the relationships that already exist within the market. And if there's opportunity to overcome some of that and increase and improve our ability to retain and or attract new patients to our systems.
Yeah, I think under that provider factors, the existing relationships, I mean, you of course are going to have doctors who have been referring to specialists that they've known for 15, 20 years. They went to med school together, their families hang out together, right? It is tough to change those patterns for sure. This is where bringing data that says, hey, we can see that you're referring all of your general surgery to Dr. Jones over here, but here's Dr. Smith, that's part of our organization, does significant volumes of these types of procedures. Their outcomes are great, very easy to access, so we can get the patients in quicker than the other surgeon you're referring to. Bringing the data, I think, is the best way to kind of counter that existing relationship. Again, those are the toughest things to overcome for sure, but funny phrase that we've heard, especially in this data space a lot, is in God we trust, all else bring data, right? So it certainly applies as you're trying to change that referring behavior, especially amongst providers, again, who have had relationships for years.
Love it. So the last piece we'll touch on, Tom, if you'll actually pull up one more poll, which kind of gets into our last piece of leveraging incremental data, where we want to kind of understand from the attendees today, how did your organization, do you feel like you have the right access to data to even, one, develop KPIs, and then two, dig into the specifics around what those KPIs are measuring, where some organizations we see feel, yes, they have everything they need to, one, both develop, communicate KPIs internally, as well as then take that same data sets, those same data sets to really, drive change within the organization, with obviously there being some fairly significant variation organization to organization. So we'll kind of let that run and then maybe come back to it right before the Q&A.
Yeah, so thanks, DJ. As I mentioned, Perception Health was acquired by Hunron, and our platform, while used predominantly in market share and alignment types of analyses, we're providing a predictive dimension that not others are providing using market-based data, just to enable that early detection of who are patients who are trending towards various diagnoses. How can we intervene sooner to provide better, more proactive care to all the patients within our market, not just the ones who we've seen in the past? So as we move to the next slide, you kind of those, again, alignment, network integrity, market share types of analyses are where a lot of our conversations begin. But I think as you start to uncover the various other activities and strategies that we can drive using this claims data set, we've gotten into more of the can we study and evaluate variations in care amongst providers? How can we prescribe the best provider to treat certain conditions and do it in the best way possible? How do we use this then to drive population health and value-based care arrangements? Again, also disease prediction, that final bullet here in this slide, with all of the data that we have and the ability to track claims to the individual patient level while not having any PHI within our database. I think, DJ, if you can go to the next slide.
Yep.
You have the ability to study those patterns and how patients are utilizing healthcare looking backwards, but then studying that and comparing it to the claims histories of people who have already been diagnosed with various conditions or have already had surgical procedures. We can study the patterns that led to that for the people who have already, again, had that diagnosis or had the procedure done, but apply that learning to patients who haven't. to ultimately be able to predict who's going to get a diagnosis or who's going to need a surgical procedure. Again, the thought here is if we can intervene sooner, we are going to make a difference in the quality of that person's life. So extremely important, again, to add that predictive dimension to ultimately tying back to what we've been talking about, patient attraction and then patient retention. If you can catch somebody who's trending towards a cancer diagnosis and get them at stage 1 instead of them just coming in for a regular annual checkup 6 months later, where that might have advanced to a stage 2 or 3 or 4, you are doing a ton to obviously impact the patient's life, but you now have a happy, satisfied, loyal patient for life as well. Moving to the next slide, how can we take this say database of medical claims to drive strategies for growth? Something that we've proven and used that's proven to be successful for our healthcare customers is one, evaluate what does that total addressable market look like. If we look at, say, all of the orthopedic surgeons in the market, what are the total charges being generated by those surgeons? How much of that is coming to us to evaluate you to really identify what is that really sales addressable market for orthopedics as a service line? Layer in the predictive capabilities. Identify those patients who are trending towards diagnoses, like we covered on the previous slide, to ultimately try to then engage them for growth. You want to then go and work with those providers. Here's a splitting physician. Maybe we're getting half of their visits as it relates to orthopedics. How can we generate better relationships, maybe drive more patients to them that they can then do procedures within our surgery centers or within our hospital? This is where, again, back to the predictive component of this and contacting patients. One of the things that we're doing is if we can see within a claims history that patient number 1, as we would see it in our database, is trending towards a lung cancer diagnosis. If we see that that patient has had any financial history with our customers in the past 5 years, we have a way to re-identify who that patient is directly from our clearinghouse partner back to the hospital or the health system. That allows them to contact and engage with those patients at a personalized level that nobody else is doing in the market today. Use that data to drive some of those patients, obviously, to your own loyal physicians for consultations or testing, but maybe to some splitting physicians in the market. If we can bring something tangible to those doctors instead of the normal physician relations spiels of better surgery times or better parking spaces or just general relationship building that anybody can do, we think the combination of all this is a great recipe for driving growth to your organization. Finally, how do we optimize? Again, use that data to understand care variation and who are the best providers at providing that care. As we move to more and more value-based care, understanding who are the best providers and including them within your networks is going to be key.
And I guess to add on to that too, Matt, I found it interesting that the outputs from, if those participating in the session today, if they felt they had the appropriate, data elements in front of them, with roughly almost 60%, 70% saying they didn't feel it was adequate for their organizations currently, to being able to ultimately get to this point, it's going to be a process. And I think it's important to reiterate that. But at the same time, if this is, I guess, the gold star of where we're trying to understand and get to, there's going to be, how do we make sure that we have the measurement capabilities in place to understand that these initiatives we're pursuing are actually being successful for our organization? And so as we transition to, we'll do a quick wrap up and takeaways, but if there are questions, please make sure that you have the ability, feed them through the chat box, and we'll get to those in just a minute or two. And so kind of trying to tie all those separate pieces together, really we want to make sure, as key takeaways from today, that the utilization of an external data source and a standard data source we find to be super, super important in being able to, one, have the ability to measure and manage those KPIs effectively, and then get into utilization of those incremental, of that data in an incremental way to drive our ability to keep those patients within our systems. We really need to be focused on both those patient attraction and retention efforts specifically, and then those efforts and KPIs need to be clearly defined and pushed throughout the organization in a systematic way that's meaningful for the individual audience, as you would expect. And then the last piece, obviously, we have a strong feeling that if you can't measure it, then you're not going to be able to manage it either. Anything else to add to that, Matt?
I think it, focusing on, that common data set and clearly using that to define how you're going to, your strategies for growth, how you're going to measure those over time. Again, I think we've hit on it a few times, but one consolidated common data set from an external perspective to do that is very important.
So we're all transitioned to, Tom. I guess we'll see if there's any questions that have come up or if people have other questions that they want to submit at this time.
Great, thank you, DJ Matt. And as a reminder, you could submit questions by clicking the chat icon on the right-hand side of your screen. And please select all panelists so that we can all see your questions as they come in. And we do have a couple that came in as you were speaking. First, DJ, somebody asked, what is your source for the ambulatory and physician office data capture? They clarified the market data specifically.
Yeah, so one of the sources that where we partner with Huron specifically is around that professional claim standpoint of being able to, and so Matt even might be able to talk to this a little bit better than myself, but being able to understand how those patients actually flow from a claims-based environment using both, Part P for fee-for-service Medicare, as well as commercial claims-based data sets, is what we found to be kind of the best way to understand how those patients flow to those outpatient sites of care.
Yeah, real quick, just to elaborate a little bit. So commercially, our sources are clearinghouses. We pick up claims as they kind of come off the switch, so to speak, as providers are submitting them through to the payers. We have a relationship with CMS to access 100% of all fee-for-service Medicare claims, and we get those 4 months after the end of each quarter, so extremely fresh data set. In exchange for that, we are doing research for CMS on our care team optimization and care variation services that we offer on that data set. So those are the two primary sources for the claims data.
Okay, thank you. And then another question that came in is somebody asked if you could speak to basic places to start with data aggregation for patient acquisition specifically.
Yeah, you want to take a stab at that, Matt?
Sure. Few ways. So one, I would start with understanding those physicians who are splitters. You already have a relationship with them. You're getting a decent share of their referrals, but how can we grow that? So that would be, say, the low-hanging fruit from a physician relations perspective. If we can, grow the volumes by 5-10%, what would that mean to your organization? The claims data set and the unique patient counts that are within it, that are flowing from those doctors to your organization and to competing organizations. Knowing that is key. Hey, if we can go drive 5-10 more patients every year, what would that mean to you? Other ways, again, our predictive capabilities. If we're able to identify people in the market trending towards diagnoses, and if they've been treated by your hospital in the past, you have there's a financial relationship that already exists between the hospital and the patient. That's what allows the facilitation of the re-identification of that patient back to the hospital directly. We stay out of it as Huron, out of the PHI, PII game there, but that information is going directly back to the hospital that you can then match up with your records to contact them via email, via phone call, depending on their risk level. I see there's a question actually about this, so I'll continue to elaborate on how are we contacting patients and engaging while staying in a HIPAA compliant or doing this in a HIPAA compliant manner. Again, so ultimately we stay out of that transaction. We just facilitate, hey, here's a list of de-identified patients that we provide to the clearinghouse. That's then being re-identified, sent back to the hospital. You're matching it up with your information about the patient within your system, your EHR. So let's say you have their email address, their cell phone number, you have their mailing address. The most basic way is, hey, maybe we see that this patient is trending towards needing their knee replaced. Let's put them as part of a marketing campaign through our CRM to invite them to some educational sessions that we have about joint replacement. You can go to as elaborate and high tech of an integration to say, all right, I'm going to feed the risk level data for the patients directly into our EMR. And it's going to create a flag so that if we can't reach and engage them directly through whether it's email or phone call, we have flagged it within the system so that when the PCP sees the patient, it pops up and says to ask about this. And see if that's been an issue for the patient. Have they done anything about it yet? If not, and if it is a concern for them, hey, let's get them referred to one of our orthopedic surgeons. So that's the way that we are doing it and staying HIPAA compliant. Again, you have the financial relationship with the patient already. That's the number one factor. How you then communicate with them, and to the extent you discuss, the predictive modeling that you've used to get there is up to you. But depending on where they are within the risk level, that kind of dictates the type of communication you would want to have with them.
And the one other piece I might add to that, Matt, too, is just as we go back to the initial, like, how do you acquire patients and how should you think about the data to do so? We typically recommend getting very geographic and service line based, where we start to identify what does, patient out migration for orthopedic services in a specific market look like, because that enables you to quickly get a lot more specific on what incremental data information you may need within your organization to drive to a lot of the pieces that Matt was just talking through.
Yeah, I think as we tie this back, again, we start with share of care and an understanding what percentage of every dollar are we getting as the hospital. But then as you start to, you set a metric and that's what you're tracking to from a KPI perspective. But what are the growth strategies we're going to put in place to increase our share of care, right? How close to 100% of every dollar can we get? It's not going to be 100% probably, but as we track and measure that growth, this is where we're working with HSG and DJ on putting in those various growth strategies that then are tracked and measured at that share of care KPI level at the executive level for their customers.
We have time for maybe one more, Tom, if it exists.
Yeah, so we don't have any. Oh, there. Yeah, I'm sorry. There is one more that just came in. Somebody asked, is there also an opportunity to improve population health through predictive analytics data? It would or could also help organizations grow in the way patients need.
Yeah, absolutely. And that's kind of where we have really begun moving to. If we can use the predictive capabilities to identify patients who are trending to diagnosis, to get in front of that, get ahead of it and catch it earlier, ultimately, it leads to better outcomes for the patient in most cases. It ultimately will then end up costing less. When you get into value-based arrangements where you're getting a fixed amount to provide care for a procedure, if we can catch it sooner, like congestive heart failure is a great example. If we can keep that patient from going into the hospital, which happens to a large percentage of CHF patients, you are saving a significant amount of money on what it's ultimately costing you, the hospital, to provide care to that patient. Let's see what we can do early from an early intervention perspective to keep that patient from ending up in your facility and better manage them.
So I guess the only other thing I'd say, Tom, is that we pull back in here that if people are interested in learning more about this or seeing how a lot of these have been applied to a specific health system, once again, in 2 weeks from today, same time, place, everything, we're going to walk through a specific example of how Baptist Health Jacksonville has actually successfully implemented a lot of the tactics and strategies that we've talked through today.
Okay, great. Well, thank you so much. Really a big thank you to DJ and Matt for sharing their expertise today. And another big thank you to HSG and Hunron for sponsoring today's program. A copy of this recording will be shared via email later this afternoon, including instructions for how to access the slides. So this concludes today's presentation. Please be sure to complete the short survey, which will pop up in your web browser as soon as the webinar closes. Thank you all, and we wish you all a great afternoon ahead.
Thanks, everyone.
Thanks, everyone.